interesting to see what, how she reacts and how she complements what you have just showed us. Francisca, are you there?
Yes, I'm here.
Okay, wonderful. We see you. I don't know if you have a presentation to share with us.
I do.
Okay. And we see it. I think, no, okay. That's the cover page.
Yeah, but it's already mine.
Okay, perfect.
I hope.
So you have the floor, Francisca, please.
Okay, great. Thank you so much. And I'm really sorry that I cannot be there present. And I'm also sorry for this delay, some mix-ups with the links to come to this meeting. So unfortunately, I only heard half of the previous presentation, but there were a lot of points that, of course, I recognize, and I'll be happy to talk about them. I'll try to put them in the presentation as well. So, of course, and really, in the same note as the previous speaker, innovation in healthcare is challenging. We are definitely not completely prepared to really innovate and to accept all of the different innovations that we can have. So first and foremost, healthcare is complex, as you know very well. And so even when we have some innovation that it's great and that we know it's really needed, sometimes it fails, not because of what it does and what it allows, but because where it is implemented, how it's going to be used, if the people that are going to be used know how to use it, are prepared, if we make it easier for them and feasible for them to use it. And so this really is, for me, the first real big challenge is if we really think about all of this complexity when we want to use something. And this requires a team effort and requires an involvement of many different actors in a hospital, from the doctors and nurses, of course, but also the managers and everybody else that works there. Secondly, even though oftentimes we know that some innovation seems to work very well, we really still need, and we put it in a way that it's very easy to use. We need to overcome some resistance that might exist. And for that, we need to show that it really creates value. And many times we don't have all of the evidence that we need and that is required to convince, for instance, a medical doctor to use something that we have available. There are other challenges, of course. These are, I think, talked quite a lot, all of the regulatory framework that we have in Europe, that some say it's really preventing innovation. I'm not so sure about that, but anyway, it's of course difficult sometimes to overcome. And there's also financial challenges, as we know, because all of these innovation is really cash intensive. So at Cluj, at our hospital, we have all these problems, and we don't have like a complete recipe to how to overcome this. We think it's of course a lot of work, and we really require the entire organization to be engaged to solve this problem, and not only ours, but even external partners. But one of the things that we're doing is, let's create a space within the group where we can all innovate and where we accept innovation from external parties, particularly the ones that don't have as much cash to be able to launch some of their innovations. So we have a test bed that we are doing in our hospitals, and that's what I'm going to show you. So this test bed is called Intelligent Health Platform. It's aimed particularly at startups and small and medium enterprises, but not only. We have 3 key areas that we accept innovation, and we have a very structured program that, and this is useful not only for the startups and SMEs that for us, but also internally, so we can best engage the people and we can create the motivation for the team to really participate and to get the profits from this program. So this testbed has 3 different pillars. The first one is an in silico lab that I'll explain in the next slide, a simulation lab, and a living lab. So I'll explain all of them. So the first one, this in silico lab, in fact, what this is a digital environment of data that is curated and anonymized, data from many different sources that we are putting together in a data lake that is open to these startups, SMEs, but also to the academia, to come to us with products that they have and be able to develop them and test them to get better performances. So this data lake we're doing, we are developing according to international standards. So SNOMED, all of these buzzwords, not buzzwords, but these catalogs of information, for lack of better terms now in English, to basically really have something that is interoperable and that can connect with also different hospitals and different groups and different companies, and is also cloud-based. So this is an effort that we have going on for 2 or 3 years now, and we think it's going to still take a long time to get to where we want to be. Even in terms of how to anonymize the information in the best way, all of this is something that we're still very much dealing with, so that we can really have something that is safe to use and that we can open to the community. The second pillar, oops, it's not right. It's the simulation lab. So in our main hospital, we have a simulation center, and this simulation center is prepared to replicate different scenarios so that we can really provide a safe environment for these innovators to experiment, to test their solutions, to understand how they are integrated into day-to-day working of the people inside a hospital and even outside, and how we can really get these products to another level before we take them to the living hospital. So our third pillar is, of course, the hospital itself. So we have a team with a lot of experience in clinical trials implementation in the hospital, and we try our best to provide this infrastructure and for the startups, SMEs, to get the data that they need for instance, medical device certification, and to really build that evidence that is so important to be able to advance and to get to the user. So doing this, we have many different roles inside the hospitals. Of course, the advisors, the doctors that are the experts in a given field and can really help and work with the innovators, managers. But I'm really putting this slide here for something that is really important, which is we have an innovation committee at Lush called the Nerds. This innovation committee is an innovation committee that has half of our executive committee. So we really have all of the organization, starting from our CEO, involved in this effort, and she's really pushing for this to happen and for us to really get as many innovative and interesting products inside the hospital and experiment with them. So we do this in a very scientific manner. So we're following scientific method. We always have a clinical study, or unless there's something else to do, but typically we always have a clinical study that we develop together with the innovators, so that we make sure that we follow a protocol and that the evidence that we collect is significant. I'm just going to skip this. So what's in it for us? Well, first, we have this direct access to fresh ideas, cutting-edge technologies from these startups, these SMEs that, as I said many times, cannot really get access to hospitals to try their products. We also create internally this culture of openness, adaptability, creative thinking, agility that is so required in today's times. We have been establishing very strategic partnerships while doing this as well. For instance, with venture capital firms that we know before and that are now sending us some of their startups before even understanding if they want to invest or not, to get our opinion. And of course, we think this also solidifies our innovative position in Portugal and hopefully also abroad. So just to, again, say this is something that we're doing, not only us, but with a lot of different entities in the Portuguese ecosystem of innovation, from startups that have also given us a lot of ideas on how to do this to academia, to VCs and others. And of course, we also have, fortunately, the Portuguese government has also been investing in these test pads, and we also received investment from them. So I'm open to any questions, if there might be some or not. Thank you.
Thank you very much, Francisca. What we're going to do is every panelist will have their presentation, and we'll have some time for questions at the end. If you can stay with us, that would be wonderful.
I will have to leave and come back. I'm sorry for that, but I had a meeting now. I'll come back.
Please do, because I think that what you showed us is extremely interesting, and I think that there will be questions for sure.